I'm Dr. Mee Mee Thet, consultant from the Obstetric and Gynecology Department, University of Medicine 1, Yangon, Myanmar. I'm also working as a specialist, fertility specialist in our fertility center, Central Women Hospital, Myanmar, which is the affiliated hospital of the University of Medicine 1. And I came here to that Merck Foundation due to the news given by one of my senior. She got also the embryologist training from the Milan Hospital and a cover of Merck Foundation last year for 3 months embryologist duration. So I got a contact with the Merck Foundation to get a training. But I came here only for the clinician 3-month course. In our center, we have only one government fertility center and the one private fertility center. I'm a government employee, but our fertility center started 2.5 years ago only. And so on that center, we have altogether 5 doctors are there, 4 for the clinical aspect, and the only one is for the embryologist. She got a trainee, as I said previously, she got a trainee from the Milan Fertility Center last year and a cover of Merck. So altogether, only 5 doctors are practicing at our center. And the fertility procedure that we provided to our country is only the IUI in dry insemination and the IVF procedure. But because of our limited facility and the limitation of the embryologist, we can do only the batch IVF. So we didn't give this fertility treatment to all our all the people in our country simultaneously. So we did the batch IVF for 2 times last year. Yes, in my opinion, Merck fertility training to get the Merck More Than the Mother fertility program is very important, not only for me, but also for our country. So we came here for the 3-month clinician course and hoping that after returning from that, I got the efficient treatment and the efficient proper treatment to our country. Overall objective is to, after return back from that training, to be an expert clinicians, and we can treat the people properly to get better results of our fertility center and better care for the infertile couple. As you all know that infertility is an also important problem in Myanmar, and the infertile people not affecting only their physical health but also their mental well-being and the social status of their childless life. So for that infertile couple, some of the infertile couples are so depressed because they get the limitation and the limitation from their relatives, from their family and their social environments. So some got the depression due to that causes. So I'm very unpleasant to feel like that, and when I see the infertile couple, so I'm very willingly to help them and to fulfill their parenthood in future. Awareness of the fertility in our country depends upon the level of the knowledge and their acceptance of their religious belief. In Myanmar, regarding with the male infertility, some of the religious believe that the infertile couple may be due to the causes only due to the female partner only. But most of our people didn't believe like that, and they accept the both male and the female factors contribute to them to infertile and didn't get any child. In here, I got the 3 months clinician course and a cover of Merck Foundation at the IIRRH. For this training, it involved in the 2 parts, and the first part is the theoretical background, like the physiology, anatomy of the male and female reproductive tract, and the theoretical background of the assisted reproductive technique like that. They explain and cover all these in their first part. And for the second part, we are now at the clinical practical staging. So on the clinical breast staging, we have learned about how to tackle the infertile couple and how to do the basic monitoring by doing the ultrasound examination and the OBD procedure, and the procedure like the operation theater, like the OPU, Usai Peking procedure. Not only this procedure, we have covered all the procedure like the endoscopy in the operation theater and the fetal medicine also. So I'm sure that training program is a perfect program to cover not only the theory but also the clinical background. And after finishing of that course, I will become an expert fertility specialist to cover all these and must fulfill the wish of our infertile couple in our country in future. So I would like to advise for the new aspirants coming to here to join the IIRRH. First, they should learn the basic ultrasound training about how to do the ultrasound machine and how to measure these trainings, and also run through about the basic assisted reproductive technique. So, based upon this underlying knowledge and added with the expert clinician course in here, they can get a platform to be a higher specialist, to be a fertility specialist, and to cover and to support to their country. I'm very glad to Merck More Than a Mother program for this training for the doctors, especially in the Asia and the Africa, to get the training. After getting of this training, we can provide the health system and the support to our people in our country to get the higher level and the efficient support. And also wanna say thanks to the IIRRH to be a perfect training center collaborative with Merck Foundation. And thank you so much.